Good morning, Dr. Van Ryssen. Would you like to talk about your experience yesterday at the BIVA meeting in Birmingham and particularly about the comparative session that you attended there?
Well, yesterday I traveled to Birmingham, where there was the BIVA meeting, the British Equine Veterinarian Association, a well visited meeting. And ASFOT had organized a comparative session, equine, canine, human talks. And the first speaker was Wayne McElraith. He is the grandfather of arthroscopy in the horse. He wrote several books about it. And he had to give an update on what is known in equine arthroscopy. He started by giving an overview of the evolution, and then immediately focused his talk on the difficulty of arthroscopy of the stifle in the horse. The stifle of the horse is too large to put in an MRI machine, so they really need arthroscopy to diagnose cartilage lesions. And there is some technical evolution about that, which he explained. And then he also talked about a cartilage repair, and he's doing quite a lot of research on that. And his feeling now, or findings, is that intra-articular injection of stem cells, free, so not in a scaffold, have the best results. And it's because of the trophic factors that are produced by the stem cells. And he reported several horses that returned to soundness, which means that they could go back to sports. Then I came with a lecture on the canine elbow. I talked a bit about the history, the technique, and we specifically have to deal with small joint space, so this could be interesting for horse people because they also have sometimes problems with small joints. I talked about the different materials, different graspers, which need to be small and strong. And then also talked about the issues of the treatment, what additional surgeries can be done to improve the results. And then finally came the human doctor, and he had a talk on ankle arthroscopy. He talked about different approaches according to the disorders there were. So you have a kind of impingement on the dorsal aspect of the joint, and then you have to remove those little pieces. It was quite clear. You can also have this problem on the plantar side. And then he also ended up talking about treatment of cartilage defects. And the technique this doctor prefers is the autologous cartilage transplant. And this is a cartilage from another human being that is transplanted in the defect of the patient. There are only a few centers in the UK that provide this cartilage. You need to have a good patient selection, but they have a 70 to 90% good success. So this was quite impressive. So in conclusion, I thought it was quite interesting to see what the others do, and I would say let's do more of those comparative sessions.
Thank you very much.